expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing the important role of the midwife during the birthing process and in other aspects of women's health care.
Yes, Errol, midwives are increasingly being depended upon to help pregnant mothers deliver healthy babies. In fact, midwifery involves caring for mother, father, and the baby both before and after birth. Joining us this evening are two experts in the field, Elam Salamanish and Leah Rupi. Both are certified nurse midwives at Bronx Lebanon Hospital Center. I may tell you that I was delivered by a midwife, and she also gave me my name, Milton. So, over the opposition of some family members. So.
Now, before we hear from you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, let me begin the program by asking each of you to really share with our viewers a respective day in the life of a midwife. And I'll start with you, Ms. Lupi.
Okay, well, normally we arrive at the clinic. Most of my time is spent in the clinic providing prenatal care, GYN care, women's health care.
Right.
So I normally get to work in the morning and I prepare my charts. I look over each and every one of my patients ahead of time so that I'm ready for them, so I have some idea of what they're coming to me for within the day, and then I start seeing patients.
And how many patients might you see in a given day?
Well, it varies depending on the day, depending on the type of visit, whether or not it's an annual gynecologic exam or if it's pregnant patients coming for prenatal care, but it could be around 30 to 40 patients in a day or much less if they're longer visits.
Now, how about you, Ms. Salamanish?
I agree with my colleagues, Ms. Rupi. Days can be varied. Sometimes as a midwife, we see patients in high-risk clinic, and we can spend much more time with them because that's the advantage of seeing patients at high-risk clinic and because of the complication they have. But usually we have a variety of cases of non-complicated prenatal care or non-complicated GYN patient that we see between 25 to 40, as my colleague said, and it varies.
Right. This is an old question, but could you answer me? What's the difference between the services provided by you and by a physician and OBGYN? Are you kind of gentler, more thorough? What? Don't tell me the bad parts, just tell me what do you think is the difference?
We both, if I may answer this question.
Go ahead.
We both provide cares for our women patients.
Yeah.
The difference is the extent of education we have. Our education is mostly focused on normal physiological pattern of pregnancies and gynecological care, and we practice patients with low risk situation. Our physician colleagues, they have more extensive education and they provide surgery and they mostly take care of complicated cases. But we have a collaboration work with our colleagues at Bronx Lebanon Hospital.
But it's important to know what's complicated and what's simpler, right? What do you-
Exactly.
yeah.
We definitely are able to know when we need our physician colleagues and then when things are able to be handled just in a low-risk setting with midwives.
But many times you triage the patients clearly, right?
We do, but we work as a team.
Yeah.
So we're never alone where we are unable to contact one of our physician colleagues, and we often are consulting with physicians and working together, or working together to take care of everyone.
Yeah.
Just what are the advantages of having a midwife involved in the delivery? And I'll start with you, Ms. Lupi, again.
Well, some of the most special things about having a midwife delivery is really the relationship that the midwife has with the patient. Midwives really emphasize developing a relationship with patients, especially if they're lucky enough to be able to take care of the woman during their prenatal care. And then if they're extra lucky and get to be there at the time of delivery, then they are able to continue that relationship. So one of I think the most special things about having a midwife during your pregnancy and labor and birth is the relationship that you get to develop with your provider.
I've seen some of the students have their midwives deliver the babies at home.
Yes,
Even in the city.
Yeah, home birth definitely is alive here in New York City.
Right.
Yes, and definitely in that case, the relationship that you have with your midwife is really very important.
Do you have anything to add, Ms.?
Well, actually, no, because my colleague, Ms. Rupi, explained it completely and thoroughly. And I agree that when you have a midwife, you have more focused care towards you to address all your concern and issues that you have during the prenatal care or during birth.
Can patients have both a doctor and a midwife in the delivery area when they're delivering? Or is it usually one or the other?
No, absolutely. We can have both. So many times when we have a patient and we triage them and they are low risk and we take care of them, at the time of delivery, there are complications can arise and we need to have our physician colleague to help us. So at the time, the patient is going to have the midwife and the physician at the bedside by the patient to provide the best care we can.
That's my next question.
Can
You
I
want to
add
Sure.
something in there? I was going to say that actually I've volunteered recently a number of times when some of the patients that I've been taking care of in labor and delivery end up needing something more that I can't offer them, their pregnancy, their labor, their birth. Something becomes more complicated. I've developed such a relationship with them that I volunteer to be there at the same time, and we end up both being in the delivery room, just simply because it's, I'm able to provide some support to the patient that I've known for so long, and at the same time, the physician's there to provide the medical care.
Okay, so my question is, oftentimes there is the birth is natural, and at the birthing period, there are situations that arise. How do you sort of answer the question, or do you want to add some more on how you handle the difficult cases?
If we are anticipating any difficulty, in advance we inform our colleagues and we let them know what complication we are expecting. If at the time of birth complication happens, all colleagues they're always in the labor and delivery room, and all we need to inform them and ask for their help and their assistance, and they'll be right there, because the whole point of the whole care by midwives or the physician is to provide the best care we can for our pregnant patient and safety of the mom.
What are some of the specific situations, and I'm sorry to interrupt you, what are some of the specific situations that may occur that a physician may need to be called in?
Some of the specific situation is sometimes that we have a difficulty of having a baby that is a little bit larger for the mom, and the mom can have difficulty giving birth, and we are anticipating problem with having the shoulders out. So we are informing our physician colleagues to just be at the bedside in helping us. That's one of the most common situations that we're going to have.
Now, in terms of Bronx Lebanon's Women's Health Program itself, what distinguishes it from other hospital such programs?
Our program at Bronx Lebanon Hospital offers a team approach to any patients, and the team is comprised from highly talented midwives and the physician and staff, including nurses, physician assistants, and the administration. We have a wide variety of the services, and one of the most important things that we are offering at Bronx Lebanon Hospital right now is group prenatal care. We have obstetric prenatal care for our teenager That is one program that not so many hospitals they have. We have GYN, gynecologic care for adolescent patient, and all the other varieties of services that not so many hospitals they have. And we have one of the largest group of midwifery services at Bronx that Bronx Lebanon Hospital offers. And we offer hydrotherapy and water birth that not so many hospitals in Bronx, they offer that.
Right.
I was talking to one of my friends and told them that I was having this program tonight. And she's pregnant. And she wanted to know if midwives prevent the patient from getting pain medication. How do you handle that?
Absolutely not. Our primary goal is to support women and help them have a gratifying birth experience with or without medication. We are especially skilled in helping women through labor without pain medication. We have suggestions we have a whole toolbox of suggestions that can help women through labor if they choose not to have pain medication. But certainly if women desire pain medication, we are more than happy to provide it.
Okay, that's the final word on that.
I agree. She said it all perfectly.
All right, now as far as pain reduction goes, perhaps each of you can describe the birthing process in terms of the Whirlpool deliveries that are available to women. How is it used? Who are the eligible candidates? And what has your experience been in terms of the results for patients?
Regarding the pain management?
Yes, as well as the delivery itself.
For using the water birth is one of the options for the pain management. And usually we triage the patient if there is no complication, meaning there is no medical problem, it's absolutely normal pregnancy and everything is fine with mom and the baby. We offer that as an option, and if the patient agrees, the patient is going to use the tub for hydrotherapy for pain management, and if she decides to have the baby in the water, she's going to have the experience of water birth, which actually I believe my colleagues recently just had a very nice water birth.
I had a very lovely water birth just this last week. It was a middle of the night birth, but sometimes...
Well, how does it exactly work, I mean, for our viewers?
Well, this particular patient came to the hospital.
What sort of age of the patient?
She was 24,
Really?
I believe, yeah. And she came to the hospital, it's her second baby. She came to the hospital in labor. And in triage, we determined that, yes, she was in fact ready, getting ready to have her baby. So we admitted her to the unit, and she said to me, right when she got there, I know that this is going to be more painful, and when I get to the point where I'm in my own world, I don't want an epidural and I don't want pain medication. And I said, okay, well, you know that labor comes with pain, so what would you like to do to try and, help yourself through that pain? She said, I am open to getting in the water, in the tub. And I said, great. Mom and baby were both healthy, doing well. So we were monitoring what we call intermittent monitoring. We have a special monitor that can go underwater. So we're able to monitor baby even while mom's in the tub. And
you should make sure Dr. Mikkel send her a special gift because she's brave, right?
She's very brave. I told her she was, very brave, very strong.
Right. But there are a good percentage of women that choose this option.
There are. I wish we had more because I love it so much. I wish we had more.
And the baby is literally born under the water?
Under the water, absolutely.
Yeah, we was living in the water for a while. Yeah.
And what are
it's
the benefits?
It's a very nice experience. But
what are the benefits to the mother as well as the baby?
To the mother is the soothing effect of the water is going to take away the pain. And it's totally different kind of experience. It's basically birth is one of a kind. And water birth is one of a kind experience. And I believe every single woman who has experienced it, they agree with me. That is one experience that they stay with them for the rest of their life.
So in terms of Bronx Lebanon, it's one of the only hospitals that offers this?
I believe I'm not sure if there is any other hospital they offer water birth. We have built-in jacuzzis in most of our rooms.
So it's a unique benefit to those that are interested in it. Okay, well, let's now pause for a short break, and when we return, we will continue our discussion, as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
Bronx Lebanon surgeons are experts in the field, bringing a diversity of skills and cutting-edge operative procedures to their patients.
But what is most important about our Bronx Lebanon surgeons is that they are responding to many difficult challenges and saving lives.
Nurses at Bronx Lebanon are also an integral part of the OR team.
We work with the surgeons in the operating and recovery rooms and are at the patient's bedside providing the necessary support and compassionate care.
In the ICU, our critical care specialists evaluate, treat, and monitor patients until they're strong enough to be transferred to a med-surg floor.
Sometimes surgical measures are necessary to breathe life back into patients, and ear, nose, and throat surgeons are called into action. Bronx Lebanon's oral and maxillofacial specialists are widely acknowledged for their expertise in all types of dental surgery.
From tooth extractions under intravenous sedation, the emergency treatment of facial injuries, to innovative implant procedures, we are clearly placing smiles for miles in the Bronx.
Bronx Lebanon is also leading the way in cardiology, dermatology, internal medicine, infectious diseases, neonatology, nephrology, neurology, pediatrics, family medicine, pathology, psychiatry, and radiology. And its Bronx Care Network, including the soon-to-be-completed ambulatory care facility, is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. A question we often ask our panelists is to share their respective education with our viewers, as well as also what interested them in their respective careers. And I'll start with you, Ms. Salakamanish.
As a nurse midwife, my education is I went to nursing school, and then after that I pursued the midwifery, and it was in Iran, and then I came to United States and I received my master from Columbia. The reason I pursued midwifery was during my nursing rotation, I had to be at the birth of a mom, which was a very difficult birth, and she did it successfully. She had a beautiful child. And then at that moment, it hit me that my mom went through a lot to give birth to me. I went home, I picked up the phone, and I called my mom, crying and just appreciating what she had done.
Right.
And I decided to do the same thing. So I became a midwife to provide the care and help and support they need when they are in pregnancy.
And for our viewers, those interested in pursuing a career, it certainly looks like it's out there for them.
Absolutely. Anybody who's interested, if they have any bachelor, they can pursue the career in midwifery through so many different programs that we have in New York, and get their master through Columbia University or any other university that they choose. Or there are different type of midwifery programs that are out there, but definitely it's out there. It's a rewarding education, and it's great to be able to help women during that stressful time of their life.
Right. And how about you, Ms. Lupe? What was your career pathway?
Very similar. I actually pursued my undergraduate nursing degree at Georgetown University, and during my rotations at Georgetown, I had the pleasure of being present at a birth, because in nursing school you have to go through all of the different rotations. So I saw the most beautiful delivery, and I thought, this is for me. This is what I need to do. So I decided to go back to school, and I actually got my midwifery degree also from Georgetown University.
Right.
And then
Okay.
that's it.
I'm not going to ask you politics. Why is it important for women to have prenatal care during their pregnancy?
Well,
first question.
It's incredibly important. Studies show that women who have prenatal care have healthier pregnancies, labor, births, babies. They have healthier babies in the end. So it's actually very important. We are able to detect.
Tell us exactly what it means,
prenatal care. Prenatal care means that we are monitoring the health of mom and baby from the beginning, when pregnancy is detected, to when the baby is delivered, and even after.
Yeah, what do you do?
What do? We check the baby's heart rate. We check all of mom's labs. We are monitoring her weight, her diet, her exercise, her blood pressure, everything about her, and everything about the baby too.
Okay, you want to add anything?
We monitor mom's well-being to ensure the mom's well-being after the baby's born and the baby's well-being by offering so many testing for the mom and for the babies.
Yeah.
Offering a sonogram to see if there is any problem that we can detect and intervene. And one of the importance of prenatal care is a study has shown that if you receive complete prenatal care, it decreases your chance of having premature baby, low birth baby, or complications.
Thank you.
Now let me ask you, Ms. Solomona, how often should a woman see a gynecologist or a midwife such as yourself? And in addition to that, at what age should they begin to see you?
Coming to GYN care is strongly recommended at least once a year, and when you see your provider, midwife or physician, based on your need is going to be addressed, how often you need to come back. But we strongly encourage our ladies out there to start coming to GYN after puberty. That is very important to be involved.
So that
and
could
to
be
know
12.
After puberty, exactly. It can be age 12, it can be 9, 14, 16, but we want you to come to Bronx Lebanon Hospital and you start your GYN care. Especially if you're young, we have, as I said before, we have adolescent program that is geared towards adolescent needs and different approach, and it's fun, and they're going to benefit from it.
Yeah. You
I was
believe
actually,
in that?
Yes, I do.
Yeah.
But I also was going to say that women should also continue to see their GYN throughout their entire lives. So from puberty on, really throughout the lifespan.
Yeah.
So.
Well, what are the things that our teenagers should be concerned about that you would counsel them or treat them or offer advice to?
Usually our teenagers come to us in need of support. Either they have become sexually active,
right, or
they're having issues with their menstrual cycle and are looking for support, looking for evaluation. So they usually come to us for those reasons.
Okay, so, and everything is confidential?
Yes.
Absolutely.
Absolutely.
Because that's a big concern of young girls. Because, as a surgeon, I've seen where every now and then the parents want to come in the room and be too present. How do you handle that? Is that a problem for you?
When our adolescent patient, I'm sorry to interrupt, when our adolescent patient, they come to us and they tell us about their concern. We usually, and most of the time, we ask their permission if their parents are there and if they want their parents to be involved with the care. If not, we listen to whatever they have to say and we give them the guidance and help they need. And if they want us to have the parents involved in the conversation, we do so. If not, everything is absolutely, totally, 100% confidential.
Mm-hmm. Okay, good. All right, okay. In general, what are some of your suggestions that each of you have for women to stay healthy? Because women are part of the problem out there with different diseases, right? I mean, not lifestyle issues, I should say. What do you tell your patients? What do you look out for? And how do you succeed?
Well, I think this is a suggestion for everyone, both males and females, but obviously maintaining a healthy diet, always trying to increase your fruits and vegetables and decrease fried foods and sugar intake.
Right.
And carbs.
Yes, all of those things help to keep you healthy. On top of that, regular exercise is very important, and very important to start early in life, because you know that later on in life you're probably not looking to start a new exercise routine.
Right.
And if I may add something to this, and to all our ladies and adolescents that are sexually active, please protect yourself by practicing safe sex and wearing condom. That is one important thing that I would like all our ladies out there to do that.
Right. Now, a question we often ask our panelists is to share their respective success stories. And Ms. Lupe, you've already given us one. I turn it over to you, Ms. Salamanas.
I remember I had twin patient that was pregnant with twin gestation, and at the end of the pregnancy, the discussion was they needed to have C-section done, and she wanted vaginal birth. And I focused to her about doing the exercise and walking. And I remember at the time of the C-section, when we did the bedside sonogram, and the first baby's head was down, and it was at vertex presentation, as we call it. Right. The patient, the way she hugged me and she cried with me, and I cried with her, that was one story that always stayed with me. Right. They were very happy because that's what she wanted from the beginning of the pregnancy, and she got what she wanted.
Oh, that's very good.
How would each of you define the role of a midwife beyond the birthing period? Baby's born. You.
I see it mostly as
30 seconds.
The midwife acts as, can be the woman's best support system, her advocate, her the person she can go to be completely honest and address all of her concerns. So I really see the role of the midwife as being a supporter of women.
And what about exercise and diet in terms of women's health? What's your advice to our viewers?
My advice to our viewers is to do exercise regularly, at least 3 or 4 times a week. And the diet, as my colleague said, just healthy diet. And everything in moderation, with exception of the alcohol.
And what about exercise and vitamins?
Taking vitamins is absolutely recommended, especially multivitamin for our patients. When they are in pregnancy, they are taking prenatal vitamin. When non-pregnant, multivitamin, calcium, especially after age, once they get towards menopause, definitely taking calcium. And fish oil is very good. I strongly recommend that to our patients.
They believe in all these vitamins. I don't know about that. I learned on the weekend that vitamin C is not important for a cold anymore. Is that, do you take vitamin C?
Yes, I do. I take vitamin C.
How can women in the community take advantage of your services very quickly? Is there a number they can call?
We would strongly ask our patient to call 1-899-BRONX. If they are pregnant, please make an appointment for prenatal care. And if you are non-pregnant and adolescent, make an appointment with teen clinic or GYN.
And you promise not to make them wait too long.
We promise to do our best to provide the best care you can have.
And on that note, let me thank both of you for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we will be continuing our discussion on women's health issues next week.
Thank you for having us.
Thank you.
Low-fat cheese sandwiches on whole wheat bread. Chewy and good for you. Snacks high in calcium help build strong bones, and foods rich in fiber are good for your heart, so you have the power to dominate. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.